It's really a pleasure to be here with you all. I'm going to speak in general about the nature and the size, how big this problem is overall, to give you a general context about the global situation of violence against children. Next slide, please. Overall, we have estimated that of the 2 billion children worldwide, about half of them, 1 billion, have been subjected to violence at any point in over a period of a year. Of those, about 1 in 4 have suffered physical abuse, 1 in 4 girls or 1 in 13 boys, sexual abuse, and self-report child sexual abuse is about 30 times higher, and physical abuse 75 times higher than official reports actually typically show. Homicide is, of course, the top of 5 causes of death amongst adolescents. So this is a problem that affects the entire globe, and it's a problem that is a very big problem in terms of magnitude. Next slide, please. Typically, to understand that, and because of lack of information in many countries, we have engaged in an activity, the Violence Against Children surveys, to depict in much more detail the nature, the characteristics, the risk factors associated to violence. So I'm going to talk a little bit about that. Next slide, please. Globally, we have actually worked in the countries that you see highlighted. We have completed several of the Violence Against Children surveys in all the countries that appear in red. The countries that appear in blue, we're actually repeating those surveys to monitor progress. And we are engaged already in preparations in a few countries, as well as a pilot study that we're doing in the United States. But the range in geography that you see, we've had some surveys in Eastern Europe, in Southeast Asia, in Latin America, in the African continent, has given us a wider picture of the magnitude and the more specificity about the nature of these problems. Next slide, please. And this is just an example of reports that are available at the Together for Girls website, and where you can actually look at the actual data, and it has also publicly available data sets. Next slide. The VACS objectives, the objectives in general of these surveys, are to look at the burden of the violence and its context, to get information on perpetrators, on the context in which it happens, focus on children, adolescents, and young kids, look at mental health issues, substance abuse, sexually transmitted infections, and a lot of health-related risk factors, but also identify protective factors related to family, to friends, to community, look at utilization of services, either for related to violence or in some cases related to HIV. And in some of the modules look at HIV. And in other countries, we look at migration patterns related to violence. Next slide, please. The VACS actually has several modules, as I mentioned, some that focus on physical violence, sexual violence, emotional violence, risk factors, health outcomes, risk-taking behaviors, HIV/AIDS testing behaviors, gender attitudes, and migration history in some cases. So it's very comprehensive from the perspective of showing how violence can affect individuals and their behaviors. Next slide. We use a methodology that is standard with adaptations for every nation. It's a national household survey. We interview people between 13 and 24 years of age, and we do it separately for males and females. We look at randomly, when in a country, we randomly select geographic areas. Within those areas, we randomly select a household, and within each household, we randomly select a person. That's a 3-stage cluster design. And these are usually led by countries, and we work on a very joint, multi-sectorial, multi-institutional approach, where before the implementation of the surveys, we go through extensive training and protocols addressing child-related issues, ethics in research, gender-related issues, violence-related issues, as well as the methodology for collecting the data. Next slide. So what are the findings? What have we found overall in a variety of the countries where we have studied? Next slide. When we look at any form of violence, and what the slide shows you here is that in general, with a few countries being the exception, In general, any form of violence, be it physical, sexual, emotional, affects mostly males than females, but it affects males and females on an incredibly high proportion. You see a wide variety, but even the countries that have a very low or the lowest sort of prevalence is not very low. It's actually very high. For the country that reports the lowest prevalence, is 1 in 5 people. That's an extremely high rate of reporting of any form of violence. Next slide. When we start separating, we see that in the cases of sexual violence is more prevalent or affects more frequently women than men. It affects both genders undoubtedly, but you can see certain differences in magnitude. And of course, you can see geographic differences as each country reports in separate ways. Next slide, please. Looking at physical violence, again, we see it's a bigger problem in terms of magnitude. It's more prevalent overall in the population, but you start seeing that in some countries it's relatively equal by gender. In others, it's more frequently in women. In others, more frequently in men. For example, in Central America, you get more frequently reports of violence, physical violence against women. In other countries, in the table, you can see that it's more frequently reported among men. Extremely, extremely prevalent and a very worrying problem. Next slide. And we transition to emotional violence. Emotional violence, the other component, affects male and females also. There's also a geographic variation between countries, but it's also a problem that has a wide variety of consequences among the people who experience emotional violence when they are young, before they are older. Next slide. What we see is that a lot of the problems when there is exposure to emotional violence lead to several mental health conditions. Here's an example of reported mental distress, be it mostly anxiety and depression, is much more frequently reported among people who experience emotional violence relative to those who do not experience it. Next slide. Likewise, we can talk about suicidal ideation. It's more frequently reported amongst people who are exposed to emotional violence than people who are not exposed to emotional violence. So emotional violence has a lot of implications in terms of mental health. Next slide. And then we also, as part of the vignette of results that I want to show you to give you an idea, we know that people tell others about their experience. You can see that for this case of physical violence, here are a few examples of some countries. A fair amount of people, more than half in the majority of countries, are telling someone about their experience. They're actually sharing that information with someone they trust. But when we ask them if they know where to go, the percentage is much lower. And when we ask them if they actually sought services, we find that the percentage is very, very small. Those are the columns that you see with those smaller percentages. It gets even smaller when you ask them if they actually received services. So when we compare what I was mentioning to you at the beginning, when we compare the report from administrative sources, the reports of violence, they're actually just the tip of the iceberg, just the top of a pyramid of a much, much larger magnitude of events, which is why it's so important to describe them much better with these types of exercises, of these surveys that can actually give us context, but a much better sense of the magnitude. Next slide, please. So with that, I just wanted to show you an overall view of the magnitude of this problem, give you a sense of the characteristics and some of the consequences as shown with emotional violence, some of the consequences that there are in terms of mental health and on the long term for individuals. Following, my colleague Daniela will give you a little bit more information on context. Thank you very much.
Hi, everyone. It's such an honor and a pleasure to be with you here today, wherever you are. Good morning, good afternoon, good evening. And so important that this entire series today and tomorrow is focused on this very specific and important and often ignored type of violence, child sexual abuse, or more broadly, sexual violence against children. And thank you, Andres, for all the great information you shared. Really important to understand the size and the magnitude of the problem. As Andres described, I'm going to talk a little bit about, well, what do we do about the problem of child sexual abuse and sexual violence against children and adolescents at large? Next slide. Before I jump into what are the solutions that work and what do we do about the problem? Just briefly on Together for Girls, Andres mentioned this earlier, but we are a public-private partnership that includes the CDC, many other US government agencies, including everyone else on this call, as well as United Nations agencies, private foundations, and most importantly, the governments of over 20 countries from around the world. Excuse me. And our focus is ending violence against children, as Janet said, but with special attention to sexual violence, which includes child sexual abuse against children, especially girls. Next. Our model is, oh, excuse me. I'm choking on nothing. Our model is pretty straightforward, and it's been the same for the last 10 years since we first started this partnership, data, action, and advocacy. We always start with data, and really CDC leads this pillar of work with the violence against children and youth surveys, and it's really understanding the size of the problem. We also do quite a lot of advocacy at a national and global level to raise awareness around this issue and the importance of addressing it. And most importantly, all of this leads to action, which is really evidence-based programs, policies, changes on the ground that can make the lives of children better. Next slide. So now to talk a little bit about, well, we know this is a pretty big problem. Andres gave us some data points here. Let's talk about the dimensions of sexual violence against children. So we really think about it in these kind of 4 layers. So at the center, you have the kinds of acts that are considered sexual violence, everything from rape to, sexual touching to solicitation of a child. That can happen in a variety of relationships. Most people tend to think that this happens only with strangers. That, of course, we know is not true. This happens in the context of families, of dating relationships, gangs, communities at large, someone who is an adult who is trusted and a person who is often in a position of trust and authority. The settings vary quite significantly as well. I mean, we know this is going on within homes, schools, the workplace, the online world. There's a huge issue with online child sexual exploitation and abuse, communities, neighborhoods. And I think of special relevance for this particular group that it happens quite often within religious organizations of every denomination. And that, of course, is something to address, as well as within sports, travel and tourism, and care systems. And finally, there are a variety of different contexts under which this can happen, including related to migration, countries with different norms, emergency and crisis settings, armed conflict, etc. But this gives you a sense of what we're talking about when we describe sexual violence against children and the various facets it could take on. Next slide. So what we did is there's a group of organizations, including CDC, USAID, PEPFAR, represented here, as well as many UN agencies led by the World Health Organization that a few years ago, including us at Together for Girls, came together and said, well, what do we know about what actually works? What does the evidence out there tell us about what works to prevent and respond to violence against children at large, all forms of violence against children? And this framework of INSPIRE was born. And you can see it's kind of clever because each letter in INSPIRE actually stands for strategy. So S is safe environments, N is norms and values, P is parenting. And so you can see here that everywhere from education to implementation and enforcement of laws, there is evidence from around the world around what works to prevent and respond to violence against children. Next slide. What we did it Together for Girls with our partners and the Oak Foundation, as well as the Equality Institute, is we said, well, why don't we take that framework of INSPIRE and actually focus specifically on sexual violence against children and what works there. So not looking at things like child labor, not looking at things like corporal punishment and other forms of physical violence, really honing in on sexual violence. And we came up with this resource for the broader global community that really showcases evidence-based solutions. It was done in collaboration with experts and allied organizations, and it really serves as a roadmap for decision makers, for advocates and program implementers around what works. Because frankly, what we found is that there are a lot of people doing a lot of interesting projects and policies and things out there, but sometimes it's coming from a good place, but there really is no evidence to show that this has any kind of impact. And in some cases, it can actually be harmful. If you study it, you could see actually that's having the opposite effect. So I want to walk you through what we found. Next slide. So I'll go through each one of these briefly. I encourage you to go to www.togetherforgirls.org to see the full resource. But for example, under implementation and enforcement of laws, we found that laws that prohibit and that mandate reporting of sexual violence against children by professionals like teachers, social service, healthcare providers, we categorize this as prudent. In other words, there aren't necessarily a bunch of very rigorous randomized controlled trials around this, but there's enough evidence to say this is an important kind of intervention. And it's especially important for all genders, but for early childhood and childhood. When you start getting into like late adolescence, we found some conflicting evidence because sometimes, for example, if a healthcare provider has to report that a 17-year-old is sexually active in that country because any activity, sexual activity under 18 is a crime in that country, then you can actually create a disincentive for adolescents who are engaging in sexual activity because they so desire to actually seek services. So this was an important distinction, just as an example of what we found around implementation and enforcement of laws. But for children in general, it is extremely important to do this. Next. Norms and values. We found that some interventions that we might hear more about later on today that really mobilize communities to change norms, attitudes, and behaviors. If they're done in a way that really engages the community, following evidence-based practices can be quite effective. Similarly, working with men and boys to challenge stereotypes, norms that justify violence, and really engaging them as important stakeholders and allies in preventing violence can be effective. And we categorize this as promising to show that there are enough studies that we encourage this to continue and to be studied further. They're not quite at the effective category where we have, over 3, high quality randomized controlled trials to show impact. Next. Safe environments. This is a really important one. Here we found that practices, for example, that adopt policies and practices around sexual violence, for example, in schools, and this whole of school approach can be extremely effective in not only changing norms and making sure kids know what to do when something happens, but are actually categorized as promising for actually preventing sexual violence from happening. The second one I wanted to flag here is this idea of safeguarding. And this is important for youth-serving organizations, including in sports, religious organizations, again, important for this audience, that we found enough evidence to categorize this as prudent, where you have things like mandatory reporting, where you have codes of conduct, yearly safety assessments, anonymous mechanisms for reporting abuse, background checks, for really making sure as an organization and as an institution, you're talking about child sexual abuse and creating the systems necessary to prevent it from happening, but also identifying it early on and then really bringing in outside institutions like the justice sector is really important. And finally, awareness raising around online child sexual exploitation and abuse is extremely important. We've seen this problem continues to grow on a yearly basis, and with the COVID pandemic, it is just skyrocketing out of control in terms of the numbers of kids who are online every day. Next slide. Parenting is a really important intervention as well. And there are interventions like Families Matter out of CDC that are promising in terms of really engaging adolescents to improve parent-child communication and are effective in preventing sexual violence and abuse. Next. Education and life skills. Again, several stand out here that I wanted to raise for you. One is this idea of school-based safe dating programs. This is an intervention that has been studied repeatedly and has shown to really reduce levels of sexual violence within dating relationships, which are actually quite elevated in most countries. Similarly, empowerment and self-defense training, especially, and both of these are especially important for early and late adolescence, can be effective in preventing sexual violence. And I have examples here on the right of those. And finally, education and awareness raising for adults who interact with children. There's enough evidence that we've categorized this as prudent. And this is really for all ages. And it's about training adults who interact with children, whether it's in schools, in religious organizations, in community-based organizations, to identify signs of abuse, to know what to do when someone tells them about abuse. And there's some really stellar programs out there that work with adults around training and education that I think would be quite relevant for this population, and especially for, I know, a lot of religious organizations who are tuning in today. Next. Finally, I just want to say some high-level implications of this work we've done is that it's really important to have, national responses that are integrated into broader protection systems for children and adolescents. We need programs that are holistic and that affect and address multiple factors that contribute to violence supporting norms and behaviors. As I mentioned, it's not about just one intervention, but multiple interventions. We also need to make sure that programs are developmentally appropriate and age and gender specific. What works for late adolescence isn't necessarily going to be the same as what works for early childhood. And it's important to understand those distinctions. And finally, programs that target children that are delivered over several sessions, that are interactive and participatory, stand out as most effective. Next. So anyway, I encourage you to go to our website again. We also have a lot of examples of the programs I've mentioned. SASA is one of them, Families Matter for Safe Dates, Coaching Boys into Men, and several others where we really highlight the programs in detail on our website. Next. And there are a series of materials that accompany what I've just described if you have interest in that. And there's a whole campaign around sexual violence solutions that we've put out there with our partners that we're excited has really taken off. Next. Yeah, the last thing I want to say to you all is, yes, more research and evidence is needed. Absolutely, we should invest in that. But today we have enough knowledge and understanding, as well as an overwhelming ethical and moral imperative to act now in the face of this preventable global pandemic that is child sexual abuse. It affects every country in the world, every religious organization, every religious sect, every social class, every race, every gender, every ethnicity, and really affects hundreds of millions of children and adolescents around the world. So thank you for tuning in. Thank you for all that you're doing already. And I think together is the only way that we're going to really change the course of this pandemic that is child sexual abuse. Thanks a lot. And I'll pass it over to, I think, Janet is going next. Thanks so much.
I'm really excited to be here today with this panel because I think that when you think about trying to conceptualize and do what we can to solve this problem on a global level, it's an honor to be part of this panel and the folks who are doing so much work around the issue. Myself and Gretchen, the next two panelists, we're both going to talk about how the U.S. President's Emergency Plan for AIDS Relief, or PEPFAR, how we are taking what Andreas presented on and what Daniela presented on and put it into practice, into programming in many countries around the world. So next slide, please. Sorry, I have to do a little bit of a manipulation to get this up on my screen. Okay, thank you. the first thing I want to say is that we get the question all the time about why is PEPFAR focusing on sexual violence against children? Because after all, we're an HIV program. There's plenty of evidence showing that sexual violence is common among young people. You saw that with what Andreas presented from the VACS, and especially amongst adolescent girls and young women. But there's also plenty of evidence showing that it's linked to their risk for acquiring HIV. And I'm going to show you a little bit of that. For those living with HIV, it also presents a barrier to their accessing and staying on treatment. So this is something that is inextricably linked with HIV. And so I'm going to talk about that link and then what we're doing about it. Next slide. This slide depicts the multitude of negative consequences related to violence against children. In addition to a direct association with HIV later in life, experiencing violence in childhood is also related to risk factors for HIV, such as other STIs, sexually transmitted infections, multiple partners, and other high-risk sexual practices. Next slide. In order to address HIV risk among adolescent girls and young women, or AGYW, we shorten it to that, we look at their complex vulnerabilities. And those vulnerabilities go well beyond their own individual behaviors. For example, Daniela talked about this, what's happening in their families, their romantic relationships, and their wider community is related to their exposure to violence and therefore to their risk for HIV. Next slide. You just heard an entire presentation by Andreas about the Violence Against Children surveys, or VACS. PEPFAR uses these surveys to make decisions about our programming. On this slide, you see that for many young people, the first time they have sex is not by their own choice. The data reveal that many were physically forced, pressured, or coerced at the time of their first sexual intercourse, especially for girls and young women. Next slide. And this violence often does not stop the first time they have sex. These VACS data on this slide show the percentage of respondents who experienced sexual violence in the past 12 months. So you can see again that both boys and girls experience sexual violence, but females at much higher rates than their male peers. Next slide. This final slide on VACS data demonstrates one of the links between childhood sexual violence and HIV risk behaviors. So what you see here is that those people who experience sexual violence during childhood, those are represented in the blue bars. If they experience sexual violence during childhood, they were less likely to consistently use condoms than those who never experience sexual violence, and those are represented in the yellow bars. So this is one of the pathways through which sexual violence put children at higher risk for HIV, other STIs, and unintended pregnancy. Next slide. So what are we at PEPFAR doing about this? Daniela presented on the different dimensions of sexual violence. We use a similar framework to think about preventing and responding to sexual violence at all of these different levels to create circles of protection around children and adolescents. Next slide. DREAMS is our partnership to prevent HIV among adolescent girls and young women in 14 countries in Eastern and Southern Africa and Haiti. It's a multi-sectoral approach that includes biomedical, behavioral, and structural interventions as depicted on this slide. We've integrated both violence prevention and response with post-violence care into what we're doing in DREAMS. And you can see that here if you look at the red, if you look at the things that are highlighted in red. And this, again, corresponds to some of the things that Daniela talked about these different levels. So we have interventions that focus on community mobilization and norms change. Some that raise awareness and build skills through community interventions or through school-based interventions. We also have parenting and caregiver programs, and then we have post-violence care and some of the clinical work that we do. Next slide. The interventions that we implement at those different levels draw from the evidence base that Daniela presented on. There are some of these evidence-based interventions that we're using with adolescent girls and young women themselves. So things like I Empower, which is an intervention developed by No Means No Worldwide, Coaching Boys into Men, which deals with those changing the way that boys and young men grow up thinking about women and thinking about things like consent. Also, we have parenting interventions like Families Matter and Parenting for Lifelong Health. And then within the community, we have, when we talk about the community mobilization and norms change, we often use an intervention called SASA, but also something called Faith Matters that faith communities can use. So these are some of the interventions evidence-based interventions that we implement. After my presentation, Gretchen Bachman is going to present on what we're doing at the organizational level to complement these interventions at other levels. Next slide. One very specific effort that I wanted to point out is a workshop that we created for community leaders, including faith leaders. And this happened after we visited 10 different countries, and we were talking about this issue of sexual violence against children. And as we met with faith leaders and other community leaders, civic leaders, school administrators, government employees, I mean, we met with all kinds of community leaders. As we met with them, they told us that they really wanted to do something to address the issue of sexual violence against children. They saw it as a problem, but they didn't quite know what to do about it. And they said they needed more information for themselves and their colleagues, as well as ideas about what they could do. So based on these interactions, one other thing that they talked about was that there were widespread myths about sexual violence in their communities. And I'll just give an example. We were shown materials in one of the countries that we visited that reinforced the myth that if girls would just be careful about what they wore, if they didn't do things like wear short skirts, then they wouldn't be raped. So they showed us and talked to us about some of the different myths that exist in their communities, and they wanted to talk about those and how to talk about those, how to communicate those in a way that would address the myths and the issue of sexual violence against children. So we used these suggestions that we got in these meetings with community leaders to create this workshop. The topics of the workshop include, you can see them on the slide there. And the topics include, what is the magnitude of the problem? We use a lot of the VAX data, like what Andreas presented. What are the consequences for survivors, their families, and their broader community? Who are the perpetrators? Daniela mentioned, or maybe it was Andreas, I'm sorry, I don't remember which of you said this, but it's often, a lot of people think it's a stranger. And so they wanted to have data to show that we really need to understand that it's not, most of the time, it's not a stranger. And so we need to know, like, who's perpetrating sexual violence against children. They wanted to know about their local laws, like what do their laws in their country say about the issue of sexual violence against children? What's against the law? What is the age of consent? Things like that. They also wanted to know how to respond when they heard about sexual violence, a case of sexual violence, whether it was disclosed to them by the survivor, whether it was disclosed to them by parents. They wanted to know what to do. And as I said before, they also wanted to know how to dispel myths. And then finally, they wanted to know, what do we do to change this conversation? And that's the final part of this workshop, really talks about changing the conversation in the community about sexual violence against children and making a commitment to end that violence. And so that's what this workshop consists of. Sorry, I've lost my place here on the slides. So that's some of what we're doing to prevent and respond to sexual violence against children. There are other things as well, but I would like to thank you for your time and your interest in this critical topic for children. We're going to now hear from our final speaker, Gretchen Bachman. Thank you.
Thanks, Janet. Much appreciated. So I'm going to talk a little bit about the part of our program that does child safeguarding. So if you could move to the next slide. So as Janet mentioned, the President's Emergency Plan for AIDS Relief supports over 6.7 million orphans and vulnerable children, or as we say, OVC, and their family members or caregivers annually across over 26 countries. And these countries are primarily in sub-Saharan Africa, but also in Haiti, India, and a few other places. Our country programs are implemented in partnership with local entities, many from civil society, from faith-based organizations, and while some are international, many are local or indigenous organizations. And one of the things that we have to be very mindful about is how we prevent abuse of children by those who are serving them. And to do that, we have to have safeguards at all levels. Next slide, please. So PEPFAR is made up of, and apologies for all the acronyms for the non-USG people, but PEPFAR is made up of several federal agencies. It's run by the State Department overall, but the United States Agency for International Development, Centers for Disease Control, Peace Corps, Department of Defense, are all players, and they all have, to some degree, orphans and vulnerable children's programs. And so they all need to be implementing within their programs child safeguarding measures. I think it's also important to point out that we also provide support through our OVC programs and others, support to our implementing partners, so those smaller groups on the ground, support so that they can develop their own safeguarding policies and plans. And sorry for the fuzzy picture to the right, but that is just showing you USAID's website and how if you're a partner to USAID worldwide, you know that there is specific guidance on child safeguarding for implementing partners. And that works its way in a number of ways, but one of the things that I think has been really important is including child safeguarding language and requirements within our contracts and grants that we have with different organizations. Next slide, please. So it was said earlier by Daniela that it's so important that all child serving organizations have safeguarding policies and procedures in place between perpetrators and children. And that is any kind of organization that serves children. That can be a youth after school organization, it can be a school, it can be a church, a mosque, a temple, it can be children's camps, it can be daycare centers. The thing that we have learned sadly over time, and there have been many unfortunate and notable cases of child serving organizations, including universities, including sports venues, where unfortunately those who are part of that program, trusted parts of the program, were actually perpetrators of sexual violence against children. And that's why we have to always be on our guard when serving children, that what we're doing to help them is not actually hurting them. Next slide. So basically, what is child safeguarding? If you boil it down, it's policies, it's procedures, put together by an organization to prevent exploitation and violence against children from occurring within the organization's walls, so to speak. And it has to be clear, comprehensive strategies that protect children. So why is this important? As I just said, children in our communities that we serve through the PEPFAR program are really coming from very vulnerable situations. There's a lot of poverty. There's been a lot of trauma because of HIV and AIDS, and also loss of one or both adult caregivers. And so we're already talking about children who are already in a situation where they could be easily exploited. And so we have to really be on our guard. The other thing, as I said, is we've learned over time the hard way that people who are likely to abuse children actually seek out positions of power and authority to gain access to vulnerable children. So we, as a donor, as someone doing programs in many countries, we have an obligation to protect the children in our programs and communities. And so who can implement them? As I said on the earlier slide, anyone who is serving children should have a child safeguarding policy and procedures. Next slide. So what's in this child safeguarding policy? One of the things is that it has to, for that organization, assess the risks of all activities involving children and develop a plan to reduce and eliminate those risks. It can be something as simple as making sure that adults are not alone with children, or that children do not sleep over someone in the program's house at night, things like that. It includes screening and selection of employees and volunteers. It includes, as Daniela mentioned earlier, codes of conduct, which really signal to those working for the program what is expected of them, that they will be held accountable if there are problems with children. It includes vigilant monitoring of interactions between employees, volunteers, and children. It can include making the physical environment safer. Most importantly, I would say, though, it really has to be a living, working policy and procedure that people use, they know how to access, and importantly, that parents and children themselves know how to make a complaint and do that without repercussions for doing so. Next slide. So we have a few do's and don'ts for child safeguarding in terms of coming up with the policies. One, the big don't, I think, is we've really, I think, hurt children by assuming that everyone who works with children is safe or will do them no harm. That it's the unfortunate truth that's not true. We recommend that organizations don't just replicate someone else's child safeguarding policy. It really has to be very driven by the organization. Importantly, don't develop a policy that sits on the shelf in the office. We've seen that far too many times. I mentioned that some of the problems with athletic programs in universities, they had policies in place, but people did not use them, right? So it's not enough to write it down. It has to be monitored. It has to be make sure that it's working. And I think also, especially for smaller organizations that don't have experience in this, don't try and do it on your own. There's lots of resources, and I'll talk about a few of those that can help you come up with a good policy. So some of the do's I think that are good are learning from other organizations, and absolutely, as I said, following up every time someone breaches a policy, even if it's harmless, such as an adult being alone with a child. It has to be clear at all times what is allowable, what is not. Next slide, please. So I did say I was going to talk to you about a few resources, and really these can be used by anyone. One of the groups that we've worked with at PEPFAR is an organization called Keeping Children Safe. They have lots of materials on their websites. They've worked with many different faith-based groups, Caritas, World Council of Churches, Islamic World Relief. They've also worked with Save the Children, World Vision, many NGOs working out there. And they've also worked with very small organizations on the ground in different countries to help them develop policies that work for them. There are also a few other resources for faith communities that I've included here, so I would encourage you to also look at those. And while I haven't put this up here, but I think any kind of training that is available in your communities that can help your staff and volunteers understand child sexual abuse. For example, in the United States, there's something called Darkness to Light that does training for organizations throughout the country so that they have a better understanding of what the risks are. So I would also encourage you to look at those. So I think that that's our last slide. We want to thank you for having us here today. And I think we're going to stick around later for any questions that folks may have. Thanks. Goodbye.